It is long past midnight. London fog presses against the window like a restless spirit, and in the hush between the clock's slow beats, we will wander together into the twilight wards of 19th century medicine. Imagine a city that smells of coal smoke, horse manure, and river rot. Imagine lanterns bleeding weak orange halos through the mist. Imagine every doorway holding either promise or peril, and no one quite sure which. Hospitals, if one dared call them that, were mausoleums for the living. Stone corridors sweated salt, and the floor was kept slick by mud from wheelbarrows that ferried the injured in and the dead out. Surgeons strode these halls like minor deities, their stiff wool coats stiffened further by old blood. They boasted of stains the way generals boast of medals. A clean apron, they said, belonged to an idle hand. Say you awoke one morning racked by sadness, a gloom that would not lift. Today we call it depression. In 1852, your physician would call it an imbalance of the humors. The cure? A friendly swarm of leeches. The glass jar burped as its lid came free, and dozens of glossy bodies slithered forward, hungry for the taste of melancholy. If that failed, there was always trepanning. The drill, hand cranked, squealing, pierced bone with a sound like ice, fracturing on a frozen pond. Some swore they felt the evil air whoosh out as soon as the skull opened. Elsewhere, a mother paced outside a birthing ward that reeked of sour linen and stale blood. Midwives moved from bed to bed without washing, their palms collecting secrets they would pass along to the next unlucky womb. Puerperal fever stalked the room, invisible as guilt. When babies died, the blame fell upon hysterical mothers, never upon unwashed hands. Asylums, meanwhile, were fortresses of brick and despair, repository for the troublesome and the misunderstood, the veteran who woke screaming, the poet who talked to ghosts, the child who seized beneath a full moon. Inside, patients were spun in rotational chairs until vomit pooled at their feet. They were plunged into ice baths so cold the skin blushed blue. One contraption compressed the skull inch by inch, under the belief that madness could be squeezed out like pus from a boil. Silence was considered evidence of cure. Most simply surrendered to it. Step now into an operating theater, called theater because it truly was a stage. Benches rose in steep rings, and spectators leaned forward, betting with one another on the clock. How quickly could the surgeon reduce a man to a stump? 30 seconds was respectable. 20, legendary. The bone saw shrieked. The crowd roared. The patient shrieked louder until shock wrung the voice from his throat. Instruments were wiped on the surgeon's lap, then returned to the tray, still warm. Pain, some argued, was proof of vitality. Others hungered for a gentler age and experimented with ether, chloroform, nitrous oxide. One Edinburgh doctor called anesthesia a gift from God. Another called it a ticket to moral decay. The debate raged while patients dozed, blissfully ignorant that the very vapor soothing them might ignite if a careless assistant lit a match. When contagion swept, cramped slums, cholera, typhus, smallpox, authorities sniffed the air and declared the stench itself the villain. Miasma theory reigned. Windows were thrown open even in January, and patients coughed ice crystals. In 1854, a physician named John Snow dared suggest water, not air, carried the scourge. He traced deaths to a single pump handle on Broad Street, had it removed, and the numbers fell like hushed voices. Still, officials replaced the handle days later. Commerce, after all, disliked inconvenience. Pharmacies operated at the crossroads of science and superstition. Shelves groaned under jars of pulverized mummy, shavings of antler, powdered toad. Laudanum, opium dissolved in alcohol, quieted teething infants. Heroic cough syrups blended morphine with chloroform. Cocaine toothache drops guaranteed relief and occasional euphoria. Consumers slept soundly or forever. The line between remedy and requiem blurred at the apothecary's door. Beauty demanded its own sacrifices. Women dabbed arsenic wafers on the tongue for a pale, ethereal glow. Mercury creams promised porcelain skin. They delivered tremors, sagging gums, and the sweet sound of teeth falling like pearls into a wash basin. Yet advertisements, lithographs of smiling duchesses, insisted the remedy was perfectly safe. On moonless nights, the resurrectionists crept through graveyards armed with shovels and a thirst for coin. Fresh corpses fetched the highest prices at lecture halls, where medical students practiced dissection. One could not become a master of anatomy without a map, and the dead were the only parchment available. Families hired watchers. Iron cages called mort safes were locked over graves. Still, the resurrectionists came, paid in gin, gold, or both by doctors who asked no questions. Quackery flourished. Traveling galvanic physicians parked black-painted wagons along busy streets. They cranked hand-powered generators, sending sizzling currents through desperate bodies. Muscles twitched. Onlookers applauded. The patient fainted. Proof, said the quack, that the treatment had taken hold. Another showman cured deafness with pistol fire. He discharged a revolver inches from a sufferer's ear. If the unfortunate soul flinched, the cure was deemed successful. If not, he was declared beyond help, and the crowd still paid. Inside smoky lecture halls, physicians debated morality by lantern light. Should we administer chloroform to women in labor? Some argued it dulled a divine punishment. Others countered that mercy was no sin. Queen Victoria herself demanded chloroform during the birth of Prince Leopold, and society gasped. But pain lost one of its final footholds. Photography crept in like a quiet observer. Post-mortem portraits captured infants in eternal slumber, cheeks rouged so mothers could remember them alive. Autopsy rooms posed cadavers beneath skylights, so flesh glistened for the camera. Medical journals published these images, half science, half vanity. The dead turned silently toward the lens, offering their bodies as cautionary tales. Field surgeons of empire refined brutality into routine. In Crimea, they amputated by lamplight, while cannon fire thundered. Ether was scarce. Rum stood in. The discarded limbs formed pyramids beside blood-furrowed trenches. Disease killed more than bullets, yet the dispatches home praised heroic medicine. Back in crowded tenements, a mother measured laudanum drops by moonlight, praying her feverish child would sleep. The bottle's label promised safety. The silence that followed felt merciful until the morning proved otherwise. Coroners wrote, "Failure to thrive," and filed the note among hundreds. Doctors chased fashion as eagerly as patients. One season they championed mesmerism, waving magnets above the skull to realign invisible energies. The next, they inhaled ozone from gleaming machines, believing electrified air could scrub the lungs clean. Each novelty found converts. Each convert found disciples. Faith filled the void where certainty was scarce, and yet, amid the horror, progress stirred. Carbolic spray hissed over wounds in a Glasgow ward, and death rates halved. A Hungarian obstetrician named Semmelweis insisted that washing hands saved mothers. His colleagues mocked him. But decades later, the world conceded. Microscopes revealed a universe of tiny assassins. Vaccines rallied humanity's defense. The darkness thinned, though it never vanished entirely. So settle now beneath your blanket. Listen to the hush that gathers when coal fires die. Remember the surgeons who carved by guesswork, the mothers who dosed by hope, the patients who endured because they must. And ask yourself, with the calm curiosity of a museum visitor. Had you lived then, would you have survived the cure? Or would your name have faded into a hospital ledger inked beside words like incurable and succumbed? Tonight, safe in the glow of modern science, you may close your eyes. Let the fog roll past your window and the ghosts of old medicine drift by, carrying leeches, scalpels, and opium dreams into the quiet beyond. Sleep well, and may no restless doctor disturb your slumber.